Greetings, everyone. We are excited about our session today. We are thankful that you have tuned in to be with us today, and we rejoice over the things that God is doing. But everyone knows that we are in perilous times, as the Word of God tells us, and we're in times where so many are, as a songwriter said, falling by the wayside. And falling, I don't just mean leaving the church, but I'm talking about those that are leaving this earth and going into glory or into eternity. And sometimes people are not prepared for what's taking place in our society. And the Bible says, my people are destroyed because of lack of knowledge. And today we have a great speaker that's going to be sharing some information with us. And she's going to talk about what to do at the end of life. She is an advanced care planning trainer and end-of-life doula. Valoria Walker partners with organizations and communities to promote the significance of planning for medical emergencies and end-of-life care. In 2016, she received her training as an end-of-life doula for the International End-of-Life Doula Association. She is the founder of her private practice called Doula by Destiny. Valoria continues to help families by volunteering at various hospice facilities to stay connected to her calling and the community. Valoria has a master in management of aging services, and she believes that a degree is an accomplishment, but having compassion is a gift. Valoria's recent accomplishment titles her as the grand prize winner of the 2019 Boom Conference Pitch Competition, sponsored by AARP. And some of the other speaking engagements that she has had in the past include an interview with O Magazine. And there is right now an article in O Magazine about her and about her accomplishment. She has also spoken at Enon Baptist Church in Baltimore, Maryland, and Mount Pleasant Church and Ministries in Baltimore, Maryland. So we want to bring her on at this time, and we bring you greetings, Valoria Walker. We thank you so much for coming on to be with us and share this great information.
Thank you. Thank you, Bishop Alvin and Lady Claire Walker, for giving me the opportunity to present to you my profession as an advanced care planning trainer and an end-of-life doula to the Lighthouse Monroe Church family. I really appreciate it. I'm going to advance to my next slide, and that really covers the introduction that you have given me, which was a wonderful introduction, and I thank you for that. Again, I am the owner of Doula by Destiny. I am an end-of-life doula, again, and an advanced care planning trainer. And I won't go through the remainder of the slide because you covered that adequately. And so I'm going to continue to my next slide. I often like to share this slide when I am presenting to let everyone know how I got started in advanced care planning. In the middle, you will see a picture of my mother, Maddie Walker, when she was going to school. It went to about the 10th or 11th grade. And so this is her graduation picture. My son challenged me to go back to school and continue my education. And I took on the challenge, and he also was in college taking classes. And when I started, my mother's health began to decline. She was in Atlanta, Georgia. My sister was her primary caregiver, and she did an excellent job. But again, my mom's health started to decline, and we didn't have the hospice outcome that we really were expecting. So my mother actually passed away Memorial Day weekend, the Friday before Memorial Day weekend. I continued my education. My son continued his education, and lo and behold, we both wind up graduating the same month. He continued with his master's degree, and I struggled behind him with my bachelor's degree. And so the month of May is a very memorial, a memory month for us. You know, it's Mother's Day. We graduated a week apart from each other in May. And also, you know, we lost our grandmother and mother Memorial Day weekend. So, you know, May is a highly memorable day, month for us. And so I like to share that story, and I thank you for allowing me to present that information about my family story. Next slide. As a doula, doula by destiny, I do not work in the capacity of providing any type of medical or legal advice. I'm not a physician. I'm not an attorney. I am an advanced care planning trainer, and there is no national standard license to practice as an end-of-life doula. My next slide talks about the agenda. And really, I would like to present the significance of advanced care planning for medical emergencies, to talk about advanced care planning for the end-of-life care. I'll talk to you about my role as an end-of-life doula and the role that faith-based organizations can participate in advising and educating their community about advanced care planning. My next slide is really about advanced care planning. So that's why we are here. What is advanced care planning? Advanced care planning, I always say, is giving direction about your healthcare choices in advance. It's personal to you. It's about your beliefs. It's about your values. It's about your culture. It's a time where you can say, no, this is about me. If you know anyone that have contracted COVID-19 and you think about the type of health care they receive, would that have been the health care that you would have wanted if you was in the same position? That's something to think about. So again, advanced care planning is the process of choosing a person to speak for you in advance. Is giving a person directions in advance if you become unable to speak for yourself. And it's also about documenting your healthcare choices and beliefs for the type of treatment you would want to receive if you become unable to speak for yourself. It is an ongoing process. It is not a Thanksgiving one-time sit at the table, talk about, and now it's over with. No, it is a continuous process. My next slide talks about the parts of an advanced care planning. The best way to start thinking about advanced care planning is really think about those who support you, your family members, your best friends. If you wasn't able to speak for yourself, think about who you would select out of that group to speak for you if you can't speak for yourself. Advanced care planning consists of selecting a healthcare agent a healthcare surrogate, a healthcare proxy. And all of those names are different, but they really give one person the responsibility to speak for you if you ever become unable to speak for yourself. Each state has different names, so you have to really be familiar with your state and what your state calls, what we call in the state of Maryland, an advanced care plan. But that doesn't necessarily mean that's what it's called in Louisiana. So the first part of advanced care planning is thinking about who you will want to represent you if you are unable to speak for yourself. The second part is thinking about your healthcare choices and your healthcare decisions and talking with your healthcare providers about those decisions. And the last part is, again, talking to your family members and making sure that everyone is on the same page. When you also talk to your healthcare provider, you can ask and request for a appointment, whether it's telehealth or face-to-face. I don't know if your state is reopening now, but you can request that your doctor give you an appointment. And normally it's about 30 minutes to talk about your advanced care plan. And it is covered by Medicare, so you don't have to worry about talking with your doctor about advanced care planning because it is covered through Medicare. As a matter of fact, I think you can get 2 sessions, 30-minute sessions with your doctor, and it is covered through Medicare. I also have a resource slide at the end of this presentation that gives you some resources for the state of Louisiana. So my next slide really talks about identifying your healthcare agent. So again, who would that person be? When we think about what happened with COVID-19, patients were medically induced and placed into a coma, left without a voice or any type of representation. Technology failed us because not unless we had a willing, able, and ready frontline worker to take a phone into a isolated room and allow us to speak to our family members, technology and the phone did not work at that time. But if you had identified a healthcare agent prior to COVID-19 and being medically induced, that person had the responsibility to talk to the doctor while you were in a coma to talk about the types of things that was happening during that particular time. So our communication was limited. You want to make sure that when you identify your healthcare agent, it's someone that you trust. It's someone that you know that will push back from doctors and not just accept what doctors are saying, that they really will take on the responsibility to advocate for you if you become unable to speak for yourself, that they will stick to your plan or be flexible in your plan once you have had several conversations with them. But they really want to make sure that your healthcare choices are honored. So for example, let's just say you wrote down, I really don't want to be on a ventilator for no more than 7 days. And maybe the doctor or the medical team is saying, well, 14 days was standard in the practice. And so again, you have to have that conversation with the doctor to make a decision based on your relationship with the patient and knowing what's best for the patient. You also want to make sure that when you select your healthcare agent, that you tell those who matter the most to you who the healthcare agent is. Because you don't want Aunt Sally to come in after a month and say, I'm making the decisions for my baby because I raised this child. No, if you have not selected Aunt Sally, you want to make sure Aunt Sally and everybody in the family knows who you have selected to be your healthcare agent so that you can keep family dynamics and confusion down. So we're going to look a little bit on the next slide to Louisiana. In the state of Louisiana, it is called a healthcare power of attorney. In the state of Maryland, we call it a healthcare agent. And so that's what I'm used to saying. But in the state of Louisiana, it is called healthcare power of attorney. That person should be at least 18 years of age and older and able to make competent decisions for you on your behalf. You should consider naming a second or even a third healthcare power of attorney, just in case, for whatever reasons, those people are not available. They could be having some things going on in their life that they are just not able to advocate for you. They could possibly come down with COVID-19. And so you want to make sure, as I always tell my son, have a plan B and have a plan C, just in case plan A is not available and doesn't work for you. Your health care power of attorney can be your best friend. It doesn't necessarily have to be your spouse, but it can be your spouse. It can be Aunt Sally. It can be your children. It can be your pastor. In the state of Maryland, the person needs to be at least 18 years old, and their provider cannot be their healthcare agent because of conflict in making medical decisions. But it can be anyone that's in your support group. You know who that person is that you can trust that will advocate for you. On my next slide, I'm going to identify your healthcare decisions and your beliefs. So when you don't create an advanced care plan, you leave the power of your decisions to your doctor. And that's fine. It's really fine, but you need to work with your doctor, and it needs to be a partnership and not all what the doctor says. Because that may not necessarily be what you want for yourself personally. Remember, advanced care planning is what's personal to you. And so you want to work with your doctor to think about all the side effects and all the options that could occur during an emergency, or if your life begins to decline. So when you really think about identifying your healthcare decisions, do you know the medical decisions your doctor will make on your behalf if you don't have a plan in place to guide medical care? Do you know what the doctor is going to be deciding? Do you understand what hydration and nutrition means? If you don't, that's something that your doctor may be deciding for you. In the state of Maryland, you can say, oh, I don't want to be resuscitated. But if you don't write it down or you don't have it documented, so let's just say I'm with a girlfriend and I've told her that I don't want to be resuscitated, that if I stop breathing, just allow me to pass away or die naturally. Don't do all these extenuating treatments to help me. Just let me pass away peacefully. Well, if I haven't written that down and she's in my home and she calls 911, when EMS and the ambulance come into my home, they are automatically going to start trying to resuscitate me because they don't pay attention to an advanced care plan. And so it really needs to be documented so that they, when they transfer you, you can be able to show, or it can be online saying, do not resuscitate me. So you want to make sure you have things documented. Let's just say you have surgery and things are not black and white and there's a gray area. Have you made decisions about that gray area? things change. And so you need to have a plan. But if you don't have no plan, the doctor's going to pretty much go with the default. Do you want to have everything done possible, even if it's not going to improve your quality of life? If it's not going to change how you're living, do you really want to have all these medical interventions, and it doesn't prolong, it just prolongs the pain instead of improving the quality of life that you are used to having and the time that you would spend with your family members. My next slide talks about really what is advanced care planning and what is an advanced directive. And so an advanced directive is a legal document. That's what an advanced directive is. And it's a legal document where you name again and select the one, two, or third person that you're going to have to speak for you on your behalf. And advanced care planning is having a conversation about the people that you want to have speak for you on your behalf. It's about the process. It's about having continuous conversations about the type of care you will want to have. It's about having the conversation with your doctor. So that's really what advanced care planning is, and an advanced directive. And a advanced directive, again, is a legal document. It acts as a guide for your families and for your doctors. And it only goes into effect if you are unable to speak for yourself. So like I talked about COVID earlier, when people were medically induced and were not able to speak for themselves, if they had a healthcare agent assigned at that time, that healthcare agent was able to speak for them. When they recover from COVID-19 and they are getting their discharge papers, they are then able to speak for their own selves, and that power is now granted back to the individual or the patient. The healthcare agent no longer has the right to make decisions for you when you are capable of making your own decisions. While you are medically unable to make any decisions, a healthcare agent cannot go out and close your bank account. They cannot close your 401k plan. They cannot decide to put your house up for sale. So a healthcare agent or a healthcare power of attorney can only make healthcare decisions. They cannot do anything that's related to any type of financial assets or liabilities that's going on with you personally. And again, they can only make those decisions when you are unable to speak for yourself. My next slide, really, I got ahead of myself a little bit, but it is talking about, again, advanced care planning, where we are in the process of having conversations with family members that eventually we hope will lead to you completing an advanced directive. And then an advanced directive is an electronic form or a paper form where everything is written down. You have named who you want to be your healthcare agent, and you have named the type of treatment you want to have if there's a medical emergency, or if you have been diagnosed with a terminal illness, or the doctor is talking about hospice care. So that's what an advanced directive is. One is a conversation and one is an actual document. And both support you when it comes to emotional, spiritual, and physical support. So that's the difference between an advanced directive and advanced care planning. My next slide talks about advanced care planning conversation continuum. And that's basically, when should I start having a conversation? Have the conversation when you're healthy, when you're able to make decisions on your own, when your healthcare agent is the person that you've already decided, and you don't want to assume that they are going to automatically take on that responsibility. Talk to them while they are healthy, while you are healthy. I started talking to my son when we lost our mother and grandmother in 2011. And actually my son surprised me in December. I was talking about it, not so much, I wasn't drilling him about it, but I made the conversation so comfortable that my son actually told me what he wanted me to do for him if he ever became unable to speak for himself. And so now I know how to honor myself and honor, he knows how to honor me, and I know how to honor my son. And if I hadn't taken the courage to have that conversation, I really would have dishonored my son, because what he told me he wanted or what he wants was not what I was thinking about doing. And so a lot of times, because we don't have the conversation, we can actually dishonor the people who we love the most, because we won't have the courage. We don't take the courage to have the conversation. So have it when you're healthy. Normalize the conversation. When people say, I don't want to talk about it, let it go for a minute. The next time you see them, tell them, well, I just take a minute and let me tell you what I want to have you to do, or the family to do, to honor me, because I just want this conversation to be about me. Just give me 1 or 2 minutes so I can talk to you about it. And so just start gentle and start small so that people can start accepting having the conversation. Have the conversation when you've been diagnosed with a chronic condition or any type of illness like diabetes, high blood pressure, high cholesterol, COPD, anything that's a chronic condition. That's a great time to have a conversation with your doctors and also with your family members. Have the conversation when you are approaching end of life, when the doctor is saying there's nothing else we can do, when you have been diagnosed with a terminal illness, anything that you know will negatively impact your health. That's when that's another opportunity to have the conversation about advanced care planning. And the conversation, this is my next slide, it's a hard conversation. I told you my mother passed in 2011. My son talked to me about what he wanted in 2019. That's 8 years, but that's okay. Now I know what he wants. So when is the best time to have the conversation? When you are, for me, I say when the pet dies. If a goldfish dies in the tank, start having a conversation then. If the dog dies, the cat dies, the rabbit dies, the bird dies, all of those are opportunities to talk about the significance of dying, and in the hope of having a pet be in peace. And so you can start that as early as 6, 7, or 8 years old. The idea time is at least when we are in young adulthood, which starts at 18. And we know that COVID impacts everybody. The age does not matter. So talking with someone at the age of 18, I know a lot of people think I'm invincible at 18, but we know that people can pass away and have medical emergencies at any age. So talk about it when you are having a 30th birthday, your 50th birthday party, your 70s, when you are having a major event, someone is going to college, someone is getting married, somebody is celebrating any type of monumental event. There could be when you are retiring, when there's a definite family and you want to talk about the funeral arrangements. When you have a major trip, look at all the people who were caught on cruises that wasn't really prepared to be stuck out to sea for as many days as they were out there. Talking about advanced care planning prior to having a trip is an awesome time. I often tell people you can take your advanced care plan with you whenever you're traveling, so you can have them along with your documents or your traveling insurance or any type of papers you take with you when you travel, your passport. And also a good time to have the conversation again is when there is a newly diagnosed diagnosis with a serious illness from your doctor. My next slide talks about the benefits of having an advanced care plan. Well, it empowers you. Before a medical emergency occurs, you are in power of the decisions that your doctor will make for you. It reduces the burden of your family having to guess. Can you just realize we have over 200 people that have passed away for COVID-19. Think about their families saying, we shoulda, we woulda, we could have. And you want to remove the shoulda, woulda, couldas by having a conversation and taking that weight off of your family members of thinking about, oh, I guess we should have did this, or maybe we should have did this, or I don't know what they wanted. By having a conversation, you will have a guide for your family members to follow. Again, it extends your authority before you get into that situation, and avoid court cases. We've heard about court cases with Prince. We've heard about court cases with Aretha Franklin. We've heard about different cases, and these are some cases that you can look up that will show you how court cases and end of life not planning does not work well together. And so these are some of the benefits of having an advanced care plan in place. My next slide really talks about the end of life doula and my role as an end of life doula. As an end of life doula, we create space when we walk into the room. We walk into the room with no judgmental biases against who you are, what you think, what you believe, what your opinions are. We really are there to sit in the space and allow you to have your last moments and to serve you the best way that we can, and to reduce any type of fear or any type of negative energy or anything that could be happening in the room during the time that you are at your last moments. We do not administer any type of medication, but we do work with the hospice team. So if someone is able to communicate and they say, I'm in pain, then we get up, we go to the hospice RN, and we communicate that to the hospice RN. So we sit by the bedside. Most of us do 4 hours, 5 hours. If a family member wants to be there, a family member cannot be there 24 hours a day. And so we try to break up sessions and allow caregivers to have a break and step away, but also know that someone is there with their family members. And so again, we provide space. We do not judge. We do not administer any type of medication. If someone is aging solo or dying solo, we sit there with that person until they transition and they take their last breath. We don't have face-to-face that's going on now, so I have been servicing my clients virtually, making a phone call to them and making sure that everything is going okay. And I advocate for them, even though I don't see them on the phone, but I definitely talk to the hospice volunteer and let them know my conversation with my client, and they go ahead and communicate that information to the social worker or either the patient's case manager. As an end-of-life doula, we support, again, individuals solo, who's aging solo. We provide physical, emotional, and spiritual support to the clients first, and then to the family members. We support healthcare choices at the end of life. And again, we work with the hospice facility to incorporate holistic end-of-life approaches to the hospice care that's provided. I actually walked into a room one evening and I had my hair cornrowed and braided, and I had a lady there that had been there for a couple of months, and we developed a pretty good relationship. And she said, "Oh, Val, I want my hair like that." Now, I knew that we was not going to be able to cornrow her hair the way that she saw mine. But I asked the hospice RN, can I just shampoo her hair and just comb it out and rebraid it? And she said, Val, I don't really have the time now, but if you take it loose, I'll show you how to shampoo, and then you can we can restyle it. And that's exactly what we did. And I would say in less than 30 days, that that friend of mine that I learned so much from in her last months, she was able to get her request honored for having her hair fixed. And so it's just little things like that that's so important and so passionate to me as being an end-of-life doula. So that's a small summary. I don't have time to stay here all night, but that's a small summary of what the role of the end-of-life doula does. On my next slide, I talk about the end-of-life doula code of ethics. And with that, we are again committed to the client first. We respect culture and racial sensitivities. We stay in our own competency. We have some end-of-life doulas that are nurses, and they can administer medication. And that is really between the conversation and the relationship that they develop with the family members. And the family members feel that they are comfortable with a end-of-life doula administering medication who is a nurse, then that is okay. And so we work within our own competency. We advocate for self-determination. I just gave you an example of I want my hair done, okay? So it's things like that that we advocate for, self-determination and dignity. And of course, we provide and keep things professional, private, and confidential. And so those are the code of ethics when it comes to hiring an end-of-life doula.
Hello, everyone. I hope you have enjoyed part 1 of Valoria Walker's When Faith Matters at the End presentation. Great information. Part 2 is coming soon. So until then, may the Lord bless you. Amen.
I lift my hands. In total adoration unto you. You reign on the throne, for you are God and God alone. Because of you, my cloudy days are long. I can sing to you this song. I just wanna say that I love you more than anything. I live